Next part that we're going to go into for Teres Minor is going to be its manual muscle test. Now the manual muscle test for our purposes is going to be basically exactly the same as infraspinatus, as since they are doing the same action at the goniohumeral joint. So I'm going to go through that again, but this will be exactly the same as infraspinatus. So I'm going to take my arm, my hand, and put it underneath his arm, and I'm going to ask him to do this external rotation until he can't anymore, or we see too much scapula or the whole goniohumeral joint lifting up. So go ahead and do that external rotation. Great. So that is the AROM, or active range of motion. I'm going to take him about halfway through that active range of motion, ask him to hold this position as I'm going to be pushing down on his radius and ulna, and just making sure his wrist and hand muscles are relaxed. And please don't let me move you for 5, 4, 3, 2, and 1. Excellent. Starting from this neutral position, I'm going to need to push all the way up through that against my resistance, the concentric component. Good. And that concludes the active break and concentric components for the manual muscle test for Teres Minor. The last thing that we're going to do for Teres Minor is the length assessment, which again is going to be very similar to infraspinatus. So you can see that I've switched my hands so that I have the upper hand kind of holding the arm. And I'm going to take my opposite hand, grabbing at his wrist, and slowly bring him up into medial rotation or internal rotation, and looking for that engagement of the tissue when we get that end feel. Again, I want to be very careful. I don't want to take him too far and move the scapula with that motion. I'm just looking for when the muscle becomes taut and I get an end feel of tissue stretch, which is about here. So that concludes everything for the muscle Teres Minor.